My name's Gavin Boyle and I'm the Chief Executive here at Chesterfield Royal Hospital. And I know that one of the most important things that our patients and the public expect from us is that when they come into hospital, they'll be protected from infections and the risks associated with them. And that's why I take infection prevention and control really seriously. And a key part of that is clean hands. You know, washing these saves lives. And I expect every member of staff within Chesterfield Royal to follow the regulations around hand hygiene very closely indeed. And what I want everybody, not only our staff but also the public and patients too, is that when you're in the hospital, use the hand gel, particularly on the way into clinical areas and on the way out. And I'd be happy that if you ever spot a member of my team who has forgotten to do that, I'd be really happy if you'd point that out to them, because sometimes, although we take it very seriously, it'll be great if the public and our patients help to keep us on our toes.
Hello, I'm Senior Matron Diane Simpson. I lead the Infection Prevention and Control nursing team at Chesterfield Royal Hospital. We try to prevent all avoidable infections, but we can't do that alone. We need your help. Please use the hand hygiene stations throughout the hospital site. Be seen to be clean. Thank you.
I wash my hands because my granddaughter at 13 years old got an infection and a virus. Spent 16 weeks in a Birmingham Children's Hospital, nearly died because it affected a liver, a lungs, a kidney and a brain and a heart. And she was a weekend from death. So I've always washed my hands since.
My name's Stuart Smith. I'm a consultant anaesthetist here in Chesterfield Royal Hospital. Healthcare associated infections cost the NHS over £1 billion a year. Help us to fight infection by washing your hands.
It's really important to wash your hands as you're going on and off of ward areas, outpatient areas and in between units. Obviously hand washing is really important to prevent infection spreading. Not only should we be washing our hands, we should be drying them correctly and making sure that we have what we call a bare below the elbow policy. So we are all trained to do that, and that's encouraged throughout the trust from day one of employment.
Hello, my name is Alfonso Tramontano and I'm Chief Nurse here at Chesterfield Royal Hospital. As you are aware, we have installed bright red hand hygiene stations across all of the trust. Good hand hygiene is everyone's business. We need to promote good hand hygiene and we are asking all staff to gel in and out of the clinical environment. Be seen to be clean.
I'm Jane Tague, Senior Matron for Critical Care. Here we look after some of the most vulnerable patients within the hospital. Please remember, infections spread easily and germs can live anywhere. Help us to prevent unnecessary admissions into the critical care unit by remembering to always wash your hands when entering and leaving the hospital.
It's really important to wash your hands, especially when you're going between wards, because this helps eliminate cross-infection. And the only way to do this is to educate ourselves, educate patients, educate visitors. We really need to do this.
Hello, my name is Dr. Ian Gell. I'm the Medical Director here at Chesterfield Royal Hospital. I'm going to talk for a few moments about the importance of hand hygiene. It's a very simple but also a very effective way of protecting patients from harm. And it's one that we should all participate in seriously, whether we're members of staff or indeed patients or visitors. It's important that members of staff are seen to be using their hand hygiene stations and washing their hands regularly when they're seeing patients and at all times when entering and leaving clinical areas, not only because this is a very effective way of protecting patients from cross-infection, but also it sets an excellent example to all staff and reassures patients and visitors that we are taking this issue very seriously indeed.
It's important that both staff and visitors keep their hands clean while entering and leaving the hospital. This stops the spread of infection for visitors. Clean hands save lives.
I'm Sheila Smith and I visit the wards regularly as a public governor to talk to patients, and I always wash my hands before I go onto a ward. As soon as you walk onto the hospital, you'll see the bright red stripe that will remind you to wash your hands. So make sure that when you see the bright red stripe, that's the signal. Wash your hands.